So, what's the most common injury which is hidden in cricket and sports, which a lot of people miss? Doctors, physicians, physiotherapists, and even for that matter, players, they don't understand what's wrong in the shoulder. Well, it's something we known as a slap tear. So, slap doesn't mean somebody slapping somebody, it essentially means superior labral tear. It can compromise the bowling action, the peak performance, and it can hinder an athlete's ability to bowl properly and leading to shortening of the career. Well, no more. If you diagnose it early, treat it properly, a lot of times surgery can be avoided, and if surgery is required, then the individuals can reach back to the peak performance. So, I'll give you the example of Mr. Hitrat. He was a good player playing in Ranji Trophy. He was a fast bowler and averaging around 130 kilometers with his bowling action. He had an injury to the shoulder where due to repetitive bowling action, he started getting pain in the shoulder. He was not able to generate the pace. We saw him, we diagnosed the problem and treated it. And now he's back to playing at full performance. And if all willing, he'll soon be in Team India. So that's the benefit of early diagnosis and treatment of these problems. So after treating multiple athletes across many continents, be them athletes from Russia, from Germany or the UK, there is a specialized algorithm we have developed to early diagnose these problems and treat them effectively so that it is not a career-ending injury. So if you look at your shoulder, essentially it's a ball and socket joint. The shoulder socket is relatively flat and the ball is round. So inherently the shoulder is unstable. It requires certain mechanisms to provide stability to the shoulder. So essentially a tissue known as a labrum is surrounding the socket. It increases the depth of the socket. A part of the biceps tendon originates from this superior part of the labrum, which acts as a biceps anchor. Now in repetitive overhead bowling action, there is a cock-up motion. During this cock-up motion, especially in young adolescent boys or girls for that matter, when they start playing overhead sports, whether it be something like badminton or bowling in cricket, you need to generate pace. So essentially for that the shoulder needs to rotate externally and go behind. That leads to stretching of the tissues in the front of the shoulder or the capsule, and the tissues behind, they become more and more stiff. This over a period of time leads to tightening of the posterior capsule or posterior capsular contracture and laxity of the anterior part of the shoulder. With regards to movement, there is a compensatory change in the arc of movement of the shoulder, which we know as a glenohumeral internal rotation deficit. So they are able to take the hand far behind compared to the other side, but the internal rotation is restricted. Now this itself is not pathological, but due to repetitive overuse and bowling action, this leads to a coup and a counter coup mechanism of injury inside the shoulder, which can manifest as a slap tear. So during this cock-up movement, the biceps is repeatedly pulled behind, and that leads to something known as a peel-off phenomena or a peel-back phenomena of the biceps, which is the slap lesion. So this can lead to decrease in the strength of the shoulder biomechanics gets altered, the ball starts moving more superiorly, it can lead to more contact with the rotator cuff, which can lead to impingement and pain, which compromises the pace, and the athlete doesn't feel at 100%. So typically an athlete will have difficulty in generating peak pace, their strength will be less, and individuals can start getting pain in the shoulder. So how do we treat this? So the first part of treatment is actually to diagnose the problem early. So early diagnosis essentially is A, with a clinical examination, which any on-field coach can do. So if an athlete is having an external rotation far more than the other side and internal rotation deficit is there is pain in the shoulder, that means that there is a possibility of a posterior capsular contracture and a slap tear. When such an athlete is diagnosed, then he should see a shoulder specialist and probably an MRI can be done. A lot of times the MRI can miss these slap lesions, so essentially special sequencing including Aber sequencing and probably a contrast in the joint can also help in diagnosing these occult injuries. In spite of that, sometimes even the MRI misses these lesions. There have been so many instances with us where the MRI has come out normal, but when we did the surgery, we found the slap lesion quite significant, extending into the posterior labrum, and post repair the individuals recovered very well. So based on the activity of the individual, the treatment algorithm is devised. So generally, if an individual is a low demand, is probably a recreational athlete or just does some sitting job, they don't play a lot of overhead sports. A lot of times it can be managed non-operatively with physiotherapy, with releases of the posterior capsular contracture and to improve the arc of movement of the shoulder. Rotator cuff strengthening exercises also can be done to elevate the pain which the individual is having. However, in active athletes who are playing overhead sports, in them generally there are two treatment options. So below the age of 25 or in those individuals where the slap lesion is associated with something known as a paralabral cyst, we do something known as a slap repair. So it's a keyhole surgery or an arthroscopy where the torn labrum along with the biceps is repaired back. That adds stability to the shoulder. The individual can be discharged the same day of the procedure since it's a keyhole or an arthroscopic surgery. They can start using their hand for day-to-day activities like writing, typing. Lifting the hand on own is not allowed till 4 weeks after the surgery, and typically with graded rehabilitation, they are able to return to sports typically by 4 months. Now when we look at other group of individuals who are athletes but not involved in overhead sports or athletes above the age of 25, the slap lesions are typically managed in a different way by a procedure known as a biceps stenodesis. So in these scenarios, we don't repair the slap lesion, but we remove the pain generator in the shoulder, which is the biceps. So we remove the inflamed portion of the biceps and fix it somewhere in the bicipital groove, that is in your arm bone. That gives pain relief and it gives very fast recovery. So typically by around 3 months, the individuals are able to return back to sports, and by around 6 to 8 weeks, strengthening can be started. So although slap lesion is a minor injury, but it can compromise the peak performance, restricting the longevity of career as well as the performance of an athlete. Now how can you prevent this? So it's very important to devise preventive strategies for this common problem. Prevention starts at an adolescent age group when actually individuals start getting into camps or bowling academies. So essentially for athletes who are looking to do fast bowling, a posterior capsular stretch, sleeper stretches need to be incorporated into the program. A graded strengthening program for the rotator cuff needs to be incorporated so that these young athletes don't end up with these injuries. It is at the young age when these problems develop. Even the bones also mold according to the action which the athlete is doing. So if we address these issues before they start, you can prevent a lot of these injuries. Three factors are very important in determining success. So one is an early diagnosis where the slap lesion is diagnosed early, where the posterior capsular contracture and abnormal shoulder mobility is diagnosed early. A lot of times these can be managed non-surgically. However, if still a slap lesion has happened, then before it spreads to the posterior labrum, or causes a paralabral cyst if we diagnose it and address it surgically. Then with third, the proper rehabilitation, the athletes are able to return back to full function and no overhead sports. So this is my point. Have it diagnosed early. We have treated a lot of international patients. So this is a point which I want to make. Any disease which is diagnosed early, treated early, can lead to a normal or a better outcome. However, the more we delay the diagnosis, the more the outcomes decline. So we have treated a lot of international as well as national level athletes with these problems, and they have been able to return to sports. If you have any queries regarding this, please reach out and share, like and subscribe to our channel. Thank you.